In most people, high blood pressure has no symptoms. This is true about in 80% of cases. That's why it is called the silent killer. By definition, high blood pressure starts when readings are above 130 millimeters of mercury for systolic pressure. When the pressure reaches 140 and higher, this is already stage 2 hypertension. At this level, some people may start notice symptoms, many of them still completely normal. When blood pressure rises above 160, symptoms appear in roughly half of cases. This is a point where body feels that something is wrong. And when blood pressure exceeds 180 over 120, this is no longer hypertension. This is called hypertensive crisis. At this level, symptoms occur almost in 80% of people, and this is dangerous even if the person says that they feel fine. Feeling okay does not mean that it's safe, and without pain or warning, and the risk of stroke or heart attack and kidney injury rises sharply. Some days blood pressure becomes higher because it naturally fluctuates. For example, if you intake a lot of salt, your blood pressure will rise, especially if you're a sensitive person. Also, stress has important role, and poor sleep, alcohol, pain, acute illness, and inflammation, they further increase blood pressure. And when blood pressure symptoms occurs, it's usually headache, especially morning headache or pressure type headache. This accounts around 40% of people with uncontrolled hypertension. It happens because elevated pressure stretches pain-sensitive structures in the cerebral vessels, and we feel it headache, and it's worse in the morning. Second most common symptom is dizziness and lightheadedness. Around 35% of people who has uncontrolled hypertension, especially in elderly, and palpitations and pounding sensation is also common. It's because of sympathetic nervous system activation, and it increases heart contractility. Sometimes visual disturbances occur, or blurred vision, or light flashes, or transient vision loss. It happens usually due to retinal microvascular spasm and pressure-induced retinal changes. And fatigue is another common symptom because chronic pressure, overload, and strain left ventricle, leading insufficient cardiac output and early exhaustion. Now, let's talk about what we can do when blood pressure is too high and action is needed. The first and most effective method is to slow, controlled breathing. This alone can reduce blood pressure around 15 millimeters of mercury within 10 minutes, and it works about in 70% of people. The rule is simple. Inhale for 4 seconds, exhale for 8 seconds, no breath holding in between, and continue this about for 10 minutes. This technique activates parasympathetic nervous system, suppresses sympathetic tone, lowers adrenaline, and increases blood vessel relax, which leads to drop in pressure. The second and simple is sitting quietly and resting around 15 minutes. This works about 50% of cases. Many blood pressure readings falsely high because movement, talking, anxiety, pain, or recent activity is important. When the body calms down, pressure often falls on its own. The third method is a warm foot bath. This also works around 50% of cases. The water should be warm, not very hot. Soak the feet for 10 to 15 minutes. This causes peripheral vasodilation, meaning blood vessels in the legs open up. As a result, blood redistributes away from the central circulation and blood pressure decreases. Drinking water can also help. Dehydration increases vasopressin and sympathetic nervous system activity, which can paradoxically raise blood pressure. And fifth method is immediate sodium reduction. When sodium intake is reduced, it can reduce blood pressure around 20 millimeters of mercury. It best works for people who are sensitive towards salt, which includes many patients with hypertension, and removing sodium lowers fluid retention, decreases circulating volume, and reduces vascular pressure. Among supplements, magnesium is the most useful at this situation. Around 400 milligrams of magnesium per day is used. It can reduce blood pressure around 3 to 7 millimeters of mercury. Magnesium works because it relaxes smooth muscle in the blood vessels, reduces arterial pressure, and counteracts excessive calcium-mediated vascular contractions, which together help lower blood pressure. Another counterintuitive but effective method is isometric hand grip exercise. This means squeezing a soft ball or a towel at about 40% of your maximum strength for 2 minutes, then resting, and repeat this 3 times. This method improves endothelial nitric oxide signaling, which leads to vascular relaxation after this exercise, and the result, blood pressure decreases. Another option is a small carbohydrate meal. For example, it can be some candy or small fruit. This can reduce stress and mild hypoglycemia if present, and may slightly lower blood pressure. However, this is not very strong or reliable method, and its effectiveness is limited. Mild walking is also important because it can reduce blood pressure importantly. When we activate leg muscles, muscle-mediated vasodilation occurs, and it lowers vascular resistance without triggering stress hormone, which is why gentle walking, not intensive exercise, can reduce blood pressure. It is important to avoid non-steroidal anti-inflammatory medications, and when medications are needed, important is captopril, which is short-acting angiotensin converting enzyme inhibitor, and it decreases blood pressure soon, about in 30 minutes, around 30 millimeters. Another commonly used medication is amlodipine. It is slower compared to captopril. That's why rescue medication is considered captopril. It is not emergency medication, but it's excellent for sustained blood pressure control. Or bisoprolol, it's a beta blocker. It's effective for stress-related blood pressure spikes, palpitations, or high heart rate. It works blocking the effect of adrenaline on the heart and blood vessels. And clonidine is a sympathetic nervous system inhibitor. It is used rarely, occasionally, and only with medical approval because it carries the risk of rebound hypertension if misused. However, when used correctly, it is very effective.